Welcome to The Vagicians. And we're here for you, the typical female, answering your not-so-typical questions women have about their health and well-being. Our panel of in-the-trench OBGYN experts includes Dr. Roslyn Mallory, Dr. Jacob Martin, and Dr. Sam Wolf, who don't shy away from the challenges of female health today. We'll discuss everything from babies to menopause, periods and breasts, and everything in between. The Vagicians podcast is brought to you by Wolf Variety Entertainment and made possible by All About Women OBGYN, the Healthy Start Program, Emerald Coast Obstetrics and Gynecology, and the Panama City Surgery Center. Let's jump right in and jam with our team of Vagicians, Dr. Mallory, Dr. Martin, and Dr. Wolf. Here's our host, Rayanne Krueger.
Everybody, welcome to episode number 1 of The Vagicians. I'm Rayanne Thorne Krueger, your host, and I'm here to welcome our panel of physicians. Hey, guys.
Hey.
Hey.
How's it going?
Welcome back to the show. We have Dr. Roslyn Mallory, Dr. Jacob Martin, and Dr. Sam Wolf. Thanks, guys, for joining me again.
Thanks for having us.
Yes.
Great to have you. So in my study, in getting ready for this particular podcast, a lot of women came to me with questions about COVID and its impact on their cycle, on a baby, if they were going to get pregnant or if they were pregnant, on getting the vaccine. So in this show, we're going to cover the impact of having COVID. If you're a woman, is it different than if you're a man? The impact of the vaccine on a woman's cycle. I have some personal interest in this. Friends of mine have expressed that it really messed up their cycle for several months. One friend has, POCS? And it really impacted
PCOS.
PCOS. Thank you. You're the experts. PCOS. And it really impacted her cycle. And then the impact of the vaccine, whether you're pregnant or not. So let's jump right into some of these myths. Dr. Wolf, Sam, I'm going to come to you first. Regarding most governmental bodies and medical societies have similar recommendations for vaccination in pregnant women. Tell me a little bit more about that.
That is definitely a myth, and that's quite untrue. And actually, there's quite a diversity amongst the opinions and the statements and the official statements that not only the governmental medical bodies, for example, the American College of Obstetrics and Gynecologists and the CDC and some of these organizations, but even across Europe, there's different countries that have completely different guidelines. For example, just to kind of step back, that's one of the bodies we look at quite often for guidelines would be the American College of Obstetrics and Gynecologists. Frequently, you guys will hear us say that in this show a lot, and we refer to it as ACOG. And if you look at their advisory, they're very specific with their wording. The wording basically says that the vaccine, if the patient is within the criteria to get, meets the criteria to get the vaccine, that the vaccine should not be withheld. It doesn't say specifically that they should get it. It says it should not be withheld. And if you see CDC's, the CDC, which is Center for Disease Control, I think most people after the pandemic know that now. But the CDC basically says that both women that are planning a pregnancy, women that are pregnant, and women that are breastfeeding should essentially be vaccinated if they choose to get vaccinated. That's kind of specific. And that's actually a quote, that they should be vaccinated if they choose. If you look across some of what the other countries are doing, there's some that kind of align with what's going on in the United States, and there's some that are absolutely completely different. For example, Austria, in the country of Austria, it's contraindicated. They state it's contraindicated in pregnancy, and
what does that mean? What does that mean, Dr. Wolf?
Contraindicated means that pregnant women should not get it.
What they
recommend instead is that they kind of embrace a cocooning effect. And when we talk about the word cocooning and we're talking about vaccines, what they mean is the family members, the people who are in close proximity to that person getting vaccinated so that one person doesn't have to get vaccinated. And that's what Austria's view as at the time of this article that was published just recently, actually, in one of our OBGYN journals this month, actually. And the Netherlands, France, Japan, they also have stated that it should not be recommended in pregnancy. Germany and the UK, it's basically a risk-based approach. And then even if you look at the World Health Organization, this is supposed to be gives the guidelines across the world. They quote insufficient data to give guidance. That's kind of what their statement is on it. So there is a lack of consensus on this. I think we'll eventually have it.
Right.
Through this episode, it may be frustrating to the listeners because we're going to say a lot of times in these questions and these myths, hey, we just don't know the answer to that. You guys have any?
Well, don't you think that's important though for us to be able to say we just don't know yet. I mean, this has been a moving target for the last year and a half almost, right?
Yeah,
And so I think it's really important to hear that from practicing physicians who are talking to patients every day. I'm sure you get questions like this every day from your patients.
Yeah, and I think transparency is like a huge thing. When we don't know something, we should come out to say it, because that in turn helps our patients and our, listeners, everybody make educated decisions. Having the data behind you and having all sides of an argument is going to really help you make a more accurate decision. And as you can see already, it isn't this straightforward, everyone should get vaccinated. Because I think our country, from a public health standpoint, right, when you think of things on a big global scale, it does make sense. You want to vaccinate as many people as possible because you're trying to shut down the spread of a disease, right? But when you do a global mass scale execution, right, not all of our patients fit that criteria, right? Because not everyone is the same. Not everyone's circumstances are the same.
Right. And for myself, I am high risk. So somebody who's high risk is going to get and receive different advice than somebody who's not. I'm an asthmatic. I've had pneumonia probably 30 times in my life. So it was definitely recommended for me to be vaccinated as soon as possible. And there's always that fear that the vaccine or a flu shot, right, something similar is going to cause me to be sick again. Have you had patients that have expressed concern about that? Am I going to get COVID from the COVID vaccine?
I can speak for myself. I've had a lot of patients who question, should I get the vaccine? I'm pregnant or I'm breastfeeding. Will it affect the baby? Will we have problems with that? And I just go over their health risks, the likelihood of them getting COVID. I go over best practices as far as hand washing, social distancing, wearing masks, especially if you're not vaccinated, and just go over the risks and benefits of getting the vaccine versus not, and letting them make their own decision as far as what fits best for them.
Dr. Mallory, continue on a little bit. Have you noticed or heard of any impact that the vaccine has had on a fetus?
We've had a couple of patients who hadn't had the vaccine. They actually had COVID, that they ended up being delivered because the baby on our testing, whether it be on ultrasound or fetal monitoring, didn't look like the baby was doing as well. But once they delivered, they came out squealing and screaming and everything was fine. So we don't know what that process is. We don't know if it attacked the placenta and maybe it was not functioning as well. Like it was basically, help me out with the word, diffusing out the
hypercoagulable state, which leads to less blood flow to the baby.
Right.
Or anything like that. But right now the pathologists don't know what are COVID changes on a placenta versus normal changes. But those babies, once they came out, all of them have done perfectly fine. Mama did perfectly fine. So it's just a state of we don't know as far as that's concerned.
And I would tell you, the initial studies did not have pregnant women in it. Okay. And so right now there's several ongoing studies. It's not uncommon. That's pretty rare that any company would ever voluntarily put pregnant patients. That's not an unusual thing. Okay. And I'll tell you that some of the effects on the fetus, I know for a fact there was a previous employee of Pfizer, was quite a big guy in the company, that kind of put out some data earlier in this. I don't remember when, but he was basically saying that one of the proteins, there's a placental protein called syncytin-1 that's very similar to the spike protein of this particular coronavirus, and that there was this theoretical risk that giving the vaccine would attack that. But that's actually been shown in a couple of independent studies that that's not quite the case.
Okay.
So there's no evidence at all that causes that.
So if we bounce off of what Dr. Mallory stated about possibly delivered or babies that were delivered early because it looked like there might have been an impact on the fetus or on the pregnancy, have you heard or do you know anything, another myth that COVID or the COVID vaccine causes miscarriages or infertility?
Well, it's known that a COVID infection, an active COVID infection, that third trimester patients can potentially get a lot sicker, just like with influenza and also preterm birth. So that's with the COVID. That's with COVID infection, not with the vaccine. That hasn't been shown yet.
And that's just because at baseline, whenever you are pregnant, our baseline physiology changes. How your heart pumps and your vascularity and essentially your blood vessels, a simple way to look at it, are more leaky. And this kind of combination of physiology can make you a lot more susceptible to infections. And if you get infections, you can get much sicker, which is one of the reasons why, we always push we strongly recommend our patients to get the flu vaccine during pregnancy, because there's really good data that shows that can help prevent them from getting ill. Because if you do get flu when you're sick, you can get much sicker.
So let's talk about immunity. So the reason for the vaccine is to definitely create immunity within a body against the infection or the virus, correct? So if somebody's already had COVID-19, should they still get the vaccine, or are they going to have the same amount of immunity? I know there's a lot of different data, statements, anything you read out there.
Yeah, so I think there's a lot of opinion on this, but there was a really good article that Nature magazine, which is a huge journal, put out July of 2020. They did this big study, and they studied a big patient population who got infected with SARS, which you guys remember the SARS outbreak back in 2003. Yeah, so they actually saw that population showed what we call T-cell immunity 17 years later, okay?
Wow.
And then they had cross immunity to SARS-CoV-2, which is COVID, okay? So what this tells us, if you extrapolate some of that data, right? So if you have documented immunity, right? So this isn't documented a positive COVID test. This is documented immunity with either proven antibodies, okay, after you've had the COVID vaccine. IgG, exactly. We know you've had that, right? There is good data to tell us that, that immunity is good for up to decades, okay? Now, your IgG titers might go away, but you have these awesome little things inside your bloodstream called T cells. And how they work is when your body gets re-exposed to the virus, okay, or, the antigen on the virus, they crank out IgG again to fight the potential virus, which is coming in. And we have good data from SARS that tells us that. So I think this goes back to my previous statement about, from a public health standpoint, you want to vaccinate as many people as possible to decrease the spread. You have patients that went to all these freestanding clinics who said, they had a stuffy nose or something. They did a nasal swab, and there was a ton of false positive tests. Okay. And everyone who had a positive swab didn't necessarily have COVID infection. So those kind of patients, if they don't have documented immunity with an IgG, right, they probably still fall into the category of where the vaccine could potentially be beneficial, right? But if you have documented immunity, I don't see any reason why you would get it. Same thing as like chickenpox. If you had chickenpox as a kid, you have natural immunity. Do you get the chickenpox vaccine? Doesn't make any sense, right?
It is a very controversial subject. And one of the worst things about this pandemic, in my opinion, is the fact that you've got a lot of non-medical people making a lot of huge medical decisions. And I don't ever think that's good. And especially the political divides that have been seen across this pandemic are, to me, just repulsive, because now you go to and you make an opinion on this pandemic as a physician, and you're labeled he must be this, or he thinks this. That I think is pathetic, and it's the worst thing of this whole thing. Because if I make an opinion about this, I'm using my medical training to make that opinion.
Yeah.
I think, honestly, I agree with Dr. Martin. If you have documented IgG and it's still good, I don't see a point in you getting the vaccine. Your body has already made antibodies. That's the same thing the vaccine would make you do. Okay. So honestly, getting the vaccine, I think at that point serves no purpose. Just continue with your natural immunity. And one good way to kind of see if you have immunity is actually blood donation or plasma donation. They're going to test you anyway to see if you have antibodies to COVID. And as long as you still have positive titers, I don't think you need to get the vaccine. Just save it and wait until later.
I think there's a resistance of the governmental agencies to sort of say that, because I think they're assuming that people will just say, I figured I had it, and I don't get the vaccine.
Or the false positives.
I'm very, very, I push. You have to actually have a blood test that shows you have these IgG antibodies.
Okay.
And just to be clear, this is not a positive nasal swab test, right? This is a blood test.
It's a blood test.
Tested your antibodies on, right? There's a big difference between those two.
Okay, we've talked about pregnancy. So let's talk about a regularly menstruating woman goes and gets the vaccine. And all of a sudden, 32 days later, she's still menstruating, right? Have you read any or seen any documentation that the vaccine is causing extended cycles for women, or causing women to not have their cycle? Or is it impacting menopausal women in a different way?
For me, I have not seen that nor read that in the literature as being a factor or a side effect of the vaccine. In theory, I can see with a hypercoagulable state that you get from COVID, and it gives you like a mini infection. Maybe you're having increased clotting, and she's seeing that as a heavy menstruation because she's passing more clots than she normally would. But as far as it making your period longer, I haven't experienced that or seen that in my patient population or in the literature.
I'm trying to think about it.
Or it could be.
I've had a lot of questions about it, and I know a lot of people have gotten the vaccine, and I don't. A lot of women that have gotten it that are reproductive age, and yeah, there are reports of that. But you have to understand, when I see 40 patients in a day, probably 20 to 25 of those patients I'm seeing are for irregular periods or menstrual problems. Okay,
they already have that. Yeah. Okay.
The incidence of menstrual irregularity is very high, and the incidence of people getting the COVID vaccine is also very high. So it's easy to try and make an association, but there's not necessarily any causality there.
The perfect storm. Right. The perfect storm.
We also know that when you emulate, as an mRNA vaccine would do, then you could potentially cause an inflammatory response. And we know when the inflammatory response occurs, cortisol levels go up. Your endogenous, meaning your homemade, your body-made steroid levels go up. That can absolutely affect progesterone levels and other hormone levels. Remember what a period is. A period is when you have a sudden change, a sudden decrease in progesterone levels. That's what triggers your body to have a period. So it's not some outlandish idea that a vaccine does this, but I will tell you, the fact that the chances of it being something permanent is almost zero.
Okay, so we've covered many rumors or myths, correct? And one thing that I want to do to wrap this show up is there have been some rumors that I guess are similar to myths, but these are maybe a little bit more humorous. One, Dr. Wolf, you shared with me, if a husband or wife gets vaccinated, I can't even say it, will the one or the other be automatically protected through lots of sex? Through lots of sex.
If my husband or wife gets vaccinated, will I automatically be protected with antibodies that get transmitted during intercourse? I actually started that rumor when I got COVID and my wife didn't. I started that rumor. No, it's obviously, I'm kidding.
George Lopez and his wife giving him the daggone kidney.
I'm kidding. So the answer to that is an absolute myth. You don't swap antibodies with intercourse. We know that. Now, interestingly, because we've talked a lot about this stuff, nobody's mentioned, but you actually do the moms pass to the baby antibodies. And there's evidence to show both ways.
Oh, good.
Vaccinated moms and moms that have natural immunity pass IgG antibodies to the baby. And there's brand new evidence also to show that there's some antibodies that are passed through breast milk as well in breastfeeding.
Okay.
And so even a small amount of IgA antibodies, which is the type that get passed through on breast milk, are actually being passed on. There's evidence to show that way as well. But I'll agree. Maybe I shouldn't have started that rumor. No,
One more thing. If you get the COVID vaccine, and since in some cases it seems to be messing up a menstrual cycle, will that work as birth control?
No, good Lord, no. Please don't do that.
Okay.
We end up in one of our offices pregnant and snot crying because you did not plan this.
We are busy enough with pregnancy as it is.
And I can't wait till some of the future episodes when we're hitting birth control because, I tell you, there's only one birth control that works.
What is that?
That's abstinence.
Abstinence. That works 100% is to not have, well... My mom told me I could get pregnant from heavy petting. So, these are the kind of things that young women are coming to, or kissing, open mouth kissing, right? So we're going to talk about all of these in the future episodes. It has been a pleasure chatting with you guys, Dr. Wolf, Dr. Mallory, and Dr. Martin. Thanks for joining us today on The Vagicians. In our next episode, please tune in for episode number 2. We're going to talk about periods. How fun is that? And more importantly, your very first period. We'll see you next time. Thanks for tuning in to The Vagicians.
Thanks for joining us for this episode of The Vagicians, where we answer the questions you may be afraid to ask. A little legalese for you. The physician hosts of this podcast are actively practicing doctors in the field of obstetrics and gynecology. They are all 3 licensed to practice medicine in their respective state and are either board certified or board eligible within their specialty. This podcast is for entertainment and education only, Any content from this program should not be considered official medical advice, and listening to this podcast should not, by any means, be considered a legal patient-physician relationship. If you have a medical issue worthy of discussion on this program, you should seek immediate medical attention with the physician of your choice. The Vagicians is made possible by our generous sponsors, All About Women OBGYN, with a mission to promote, protect, and restore health in women's reproductive systems and a legacy that spans greater than 50 years. You can trust all your women's healthcare needs to All About Women OBGYN. Healthy Start Coalition of Bay, Franklin, and Gulf counties. Healthy Start's mission is to promote healthy pregnancies, babies, and families by providing services and facilitating access to resources through community partnerships while advancing racial equity and cultural responsiveness. Emerald Coast Obstetrics and Gynecology. Offering a dedicated medical care team, Emerald Coast specializes exclusively in women's health services in Panama City, Florida. And Panama City Surgery Center. Located in Panama City, Florida, the Surgery Center offers top medical specialties and services in one convenient location with minimally invasive outpatient procedures to get you back to normal life quickly. The Vagicians podcast is produced by host Rayanne Thorne Krueger. Our editor is Igor Kuzmanovsky, with Ike Zabala as our announcer. And finally, a special thanks to our spouses, partners, and families for their support, ideas, and feedback.